everybody. This is Dr. Kyle with ICE Clinics, bringing you your next tip for Tuesday. What I want to do this Tuesday is kind of give a little gentle reminder for those of you watching and wondering if you're a candidate for chiropractic, even though you may not have much back pain, much neck pain, or pain anywhere else in your body. One thing I want to point you to is that all chiropractors who focus on addressing the spine deal with this one fundamental concept right here, which is an intact nervous system will lead to an optimum functioning of the human body. So the key word is optimum, and then obviously function is a very important word as well. But so many of us are kind of focused on just keeping our symptoms at bay. So if we don't have symptoms, we're healthy. But if you look at the body more from this angle, you'll see it from a much bigger picture. So if you come in here, in a lot of our treatment rooms, we have good kind of text and posters here you can look that have lots of different good information on there. This one in particular highlights what we just talked about in that quote. And for those of you that watching that have never had any experience with chiropractic, something to really key into. So as far as optimizing what the nervous system and body functioning is doing, understanding this chart is really key. And I remember when I went to my first chiropractor when I was 14 years old, he showed me this exact chart and he just said, hey, look how it's all interacted, it's all connected, and all functions together. So for me as a 14-year-old, that made a lot of sense, just kind of glancing and seeing how all that worked. But really quickly, if you come in and appreciate that our spine here is the common access point that our organs are attached to our brain in most cases. We also have hormone function to go with in our autonomic nervous system. But again, if you can basically understand it from this standpoint, it'll make a lot of sense. So for lots of patients that we see come in our office, say the upper neck, for example, C1, C2, not only are they complaining of chronic pain here, maybe some headaches, maybe some jaw pain, but coincidentally enough, they have sinus trouble, or they have allergies, or they have dizziness or vertigo, chronic tiredness, something a lot of us, I think, can relate to. Or we also have a lot of patients that will come in, say that sit at a desk all day long, and they have lots of stiffness and tightness in this part of their back right here, or maybe they're concerned about a dowager's hump presentation. If you run over to the nerve roots that come off that area of the spine, you can see other common conditions like asthma, thyroid conditions, very common. We see even kind of breathing issues that we'll see. And then coming downwind, we see lots of patients that are feeling very stiff and compressed in this kind of lower middle region of our spine. That's interconnected with some of the filtering of our body, so with kidneys, with our bladder, and especially as you'll see right here at T9, we see tons of patients with issues with their adrenal glands, kind of an adrenal burnout presentation. Last but not least, if you cruise down to the very bottom area here, you'll see L5, L4. Those will go to our lower legs, ankles, feet, so it goes anywhere from poor circulation to weakness in the arches. And again, I think as most people would interpret their symptoms, they look at it whether do you have aches, do you have pains, and if you don't have those things, then maybe you don't necessarily have issues. But I think it's always important to study this chart and just appreciate how everything is interconnected. So I'm really trying to reach out to those of you watching this video. If you have symptoms that maybe match with some of your back pain or maybe extremity pain, chiropractic is a really good conservative option to consider. And I would encourage you to try and reach out to us or another trusted resource if you can. Again, my name is Dr. Kyle with ICE Clinics. Thanks for watching.